you doing? Good. Good. I'm well. Thank you for asking. Just grab my hand sanitizer here. Alright. And your file. We have quite a file on you. No, we just like to keep good records. So tell me a little bit more about what's brought you in here today. Okay. Alright. And how long would you say that that's been going on? Okay. Yeah? Well, there's a lot going on right now, so stress and tension definitely seem to be going around. Okay. Yeah, tell me more about that. All right. Well, okay. Well, I'll tell you what I'd like to do. What you're telling me sounds like pretty normal symptoms of stress, but I think we should conduct a cranial nerve examination just to help us verify that there's nothing else going on there that we should be concerned about. Okay? Yeah, it's pretty simple, pretty straightforward, and totally painless, basically. So I'll just talk you through it, and we'll make sure that everything checks out. Okay? Okay, good. All right. I'll just grab a couple implements that we will need here. And to start off with, we're going to look at your olfactory nerve, which is all about your sense of smell. So we have some cotton wool here, and I'm just going to place a scent on there, and I want you to tell me what it is, okay? There's no trick questions, it's pretty simple, but just to make sure that nose is doing what it needs to do. Okay. So just tell me what you smell. Vanilla. That's right. Very good. It's a very relaxing smell, isn't it? For sure. Okay. And next we're going to look at the optic nerve, which of course is all about the eyes. So I have this eye chart here, and I just want you to read the lowest line on the chart, or the lowest line that you can read, okay? Alright, very good. And there are two colored rectangles on the bottom of the chart. Just want you to tell me what color the left rectangle is, and the right. Very good. And you've never had any troubles with color blindness in daily life, right? Okay, very good. Next, I'm going to check your peripheral vision, and I'm just going to move fingers on my hand, and I just want you to tell me which hand I'm wiggling my fingers on, okay? Great. Good. Good. Yep, both. Very good. Let's just... Okay. Yeah? Mm-hmm. Yeah? Good. Uh-huh. Good. Alright, perfect. Let me just grab my little light here. And what I'm gonna do, I'm gonna just hold my hand here between the eyes. And I want you to just look straight ahead for me, and I'm gonna shine the light into your eye, okay? Just keep looking straight ahead. There we go. Alright. Let's try the other side. Okay. Alright. Okay, perfect. Now let's have a look at the trigeminal nerve, which has 3 parts: the mandibular, the maxillary, and the ophthalmic on the forehead. And again, I'm just going to take some cotton wool, and what I'm going to do is just run it along parts of your face, and I just want you to tell me what you're feeling, okay? Okay, good. Okay. You're feeling that? Okay. Very good. Just tell me what you feel there. Okay. And here we go. Right. And how about that? Alright, yeah, that's the ophthalmic nerve with the forehead. Good. I'm actually going to do a very similar thing. This time I'm just going to use my blunt tip here. And you just tell me where you're feeling it. Okay? Good. Mm-hmm. Okay. Yeah. Mm-hmm. Okay. Good. Let's hit that maxillary nerve. Good. 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 Yes. Right, and here we go. There we go. Mm-hmm. Mm-hmm. Right. Very good. Up next, we have the ocular motor, abducent, and trochlear nerves. And these are all about controlling the eyes. So we're actually going to do the same tests for all of them. Okay. And I just want you to follow my fingers. Just keep your head still. Track my fingers with your eye. Just follow my fingers. Here you go. Just use your eyes to follow them. Here we go. Good. Now we'll look at your facial response. I want you to clench your teeth. Clench up your jaw like that. I'm just going to feel the musculature here. Yeah, just clench. Clench those teeth. Perfect. Alright. And I'm going to press against your jaw. I just want you to try to open against that pressure. Try to open your jaw. Just pressing, try to open. Very good. Stop. It's hammer time. Quite literally, actually. For the next part of the test, I'm going to hit you with the hammer. And don't worry, it's not going to hurt. It's just going to be a light tap on your chin, just to look for the right tension and nerve response, okay? Alright, so I'll just put my finger here and we'll do a little tap. And a tap. Good. That's it. That's all there is to it. Alright. Now what I want you to do is lift your eyebrows to crease your forehead. Just like that. Very good. Okay. And now I'm going to have you close your eyes and I'll try to open them, and I just want you to keep them closed as I try to open them, okay? So close your eyes for me, okay? And I'm going to try to open them. You're keeping them closed. You're keeping them closed. Alright, good. You can open your eyes again. Now, puff out your cheeks for me. Okay, very good. And a nice big smile. Show me those teeth. Nice smile. Perfect. Okay. Let me just jot down a couple of notes on our progress here. Yeah, there's just a little bit more, but you're doing fine. Okay. I'll need another tool for this. Alright. I have my tuning fork. And what I'm going to be doing is make the tuning fork ring. And I'm going to touch it to a couple of spots on the side of your head. And I just want you to tell me which of the spots is louder, okay? We'll start on this side. Spot 1. Spot 2. Which one was louder? Okay. Spot 1. And spot 2. And which one was louder? Okay, good. And now this time, I'm actually going to place it in the center of your forehead, as if you were a unicorn, a tuning fork unicorn. And silly as that sounds, what I'll want you to do is just tell me if it's louder in one ear versus the other, okay? Alright. Just put that on your forehead. Alright. Good. And one more time. And was it louder in one ear versus another? Okay. Good. Alright, up next, the glossopharyngeal nerve. And this one has a slight amount of discomfort associated with it. So I'm going to have you open your mouth, and I'm just going to touch a couple points in the back of your mouth. It can be a little bit caggy, but we'll just get it over with. So go ahead and open wide for me. Okay. Just going to touch in there. Yeah. Okay, good. That's it. Now, I'm going to have you open wide. I want you to say, ah, like you're at the doctor, because you're at the doctor. So open wide and say, ah. I'm just going to make sure that the throat muscles and the uvula all respond correctly, okay? So open wide and say, ah. Great. Perfect. All right. Which brings us to our final nerve of the examination, the accessory nerve. And this helps control the neck and shoulders. So what I'm going to do is I'm going to apply some pressure to your shoulders. I want you to try and shrug them up. Just lift them up like that, and I'll just apply some downward pressure to them for some resistance. Okay? Alright, good. Let's try. Alright, I'm just going to press down and go ahead and shrug your shoulders. And shrug. Perfect. Alright, and now similarly, I'm going to have you try to turn your head. Just going to have my hands on your face, applying some pressure, resisting that turn. And you're just going to go ahead and try to turn your head against that pressure. Okay? All right. So just going to get my hands here on your face and go ahead and try to turn your head. Turn against that pressure. Okay? And the other direction. Go ahead. Good. And back this way. Perfect. And this way. All right. Okay, good. All right, and the very last check involves your hypoglossal nerve. And this is an unusual test. All I want you to do is just stick your tongue out at me. Just stick it straight out. Yeah, just stick your tongue out at me. Okay. Very good. All right. Well, that completes your cranial nerve exam. Found no neurological issues, nothing to be concerned about or that we need to follow up on. Okay. Let me just make a note of all this so that we have the record that we did the exam and it was completed without any concerning issues found. Okay. So yeah, I think, it seems like you're probably feeling some stress and tension, and that's had some manifestations, but, I think what you laid out for me at the beginning, I think continue with that. Try to relax when you can, get good sleep. I'm actually going to provide you with some resources on that. I have a video that you can watch which covers more of the topic of what you can do to sleep better, a sleep checklist, if you will, help you get the best sleep you can, and hopefully that, combined with some stress reduction, can help ease some of the troubles that you've been facing. Yeah, well, I'm absolutely glad that you came in. Happy to, give you an examination, just to make sure that we didn't have anything else going on. Looks like we're good on that front, but if you continue to have issues or if something else comes up, definitely want you to give us a call and we can bring you back in and check things out. But until then, I wish you well and have a good day.